Hi friends, good evening and welcome to my channel Mokambika Nursing. Friends, here in this video we can see important and previous year questions for RRB staff nurse exam preparation, also DME, ESIC, DSSSB and AIIMS NORCET exam preparation. We can see the questions one by one. The first question, after laryngectomy, which of the following assessment takes priority? Options, option A airway patency, option B lung sounds, option C fluid status, option D nutritional status. Question, after laryngectomy procedure, which one is the priority nursing care? Laryngectomy means it's a surgical procedure to remove the larynx partially or completely. Okay, partial laryngectomy is there, also total laryngectomy is there. Here our question is, nursing care after laryngectomy will focus on, firstly we will focus airway. Option A is the correct answer, airway patency. After laryngectomy, carefully we have to assess the airway, then lung sound, then position of the tracheostomy tube, and also if there is any complication occurs to the patient related to the surgical procedure or related to the tracheostomy tube. These are the some early post-operative assessment of laryngectomy after laryngectomy. And the next question, most common cause of blindness in India is option A cataract, option B glaucoma, option C conjunctivitis, option D refractive error. Most common cause of blindness in India is cataract. Option A is the correct answer. And the next question, 1 week after kidney transplantation, the client develops temperature of 101 degree Fahrenheit. The BP is elevated and the kidney is tender. The X-ray shows that the transplanted kidney is enlarged. Based on the assessment findings, the nurse would suspect which of the following complication? And our options, option A acute rejection, option B kidney infection, option C chronic rejection, option D kidney obstruction. Here our question is, 1 week after kidney transplantation, the client develops temperature 101 degree Fahrenheit and elevated BP, that is hypertension, and kidney is tender. Then in X-ray it shows that the transplanted kidney is enlarged. So based on this all findings, what will be the complication does the patient experience? That is the question. Here we can see the clinical signs and symptoms of kidney transplant rejection. Okay, firstly the temperature will be higher than 100 degree Fahrenheit, and also patient may experience pain, tenderness over the transplanted kidney, and edema, hypertension, malaise, elevated blood urea nitrogen and serum creatinine level, also elevated WBC count and decreased creatinine clearance. So here answer will come option A acute rejection. Acute rejection and option C chronic rejection is there in our question. 1 week after kidney transplantation. So this acute rejection most commonly occurs within the first 2 weeks after transplantation. So here answer is acute rejection. In chronic rejection, it occurs gradually over a period of month or a period of years. Okay, so acute rejection occurs within 2 weeks after transplantation. So that is the correct answer. And the next question, normal blood urea nitrogen level is options. Option A 2 to 8 milligram per deciliter, option B 8 to 25 milligram per deciliter, and option C 15 to 30 milligram per deciliter, and option D 20 to 35 milligram per deciliter. And the correct answer is 8 to 25 milligram per deciliter, normal blood urea nitrogen level. And the next question, a nurse is assessing the client with epididymitis. The nurse anticipates which of the following finding on physical examination? Option A fever, diarrhea, groin pain. Option B nausea, vomiting, scrotal edema and ecchymosis. Option C fever, nausea, vomiting and painful scrotal edema. Option D diarrhea, groin pain and testicular torsion. Here our question is, a nurse is assessing the client with epididymitis. Okay, diagnosis of the patient is epididymitis, and which of the following assessment does the nurse will get while doing physical examination? That is the question. So epididymitis means it's a acute or chronic inflammation of the epididymis. Cause for this epididymitis is mainly due to urinary tract infection is one of the cause, or sexually transmitted disease, or long-term use of catheter also cause epididymitis. The main signs and symptoms we can see: first one, scrotal pain. Patient may experience groin pain and swelling in the scrotum and groin, and pus and bacteria in the urine. Then the patient may have fever and chills and abscess formation. These all the signs and symptoms. So among the signs and symptoms, which one will come correct? We can expect it is option C, that is fever, nausea, vomiting, painful scrotal edema. All are the signs and symptoms of epididymitis. Okay, so here option C is the correct answer. And the next question, normal length of portal vein is option A 4 cm, option B 6 cm, option C 8 cm, and option D 12 cm. The normal length of portal vein, it is about 8 cm. Option C is the correct answer. And the next question, golden period for eye donation is option A 2 to 4 hours, option B 4 to 6 hours, option C 6 to 8 hours, option D 8 to 12 hours. And the correct answer is option C 6 to 8 hours. After death of a person, we can preserve the cornea for 6 hours. Okay, here 6 to 8 hours is there in our option, so that will be the correct answer. And the next question, U verb is seen in which of the following condition? Options, option A hyperkalemia, option B hypotension, option C hypokalemia, option D hypocalcemia. U wave is seen in, and the correct answer is, it is hypokalemia. Hypokalemia means serum potassium level will be below 3.5 milliequivalent per liter. Normal is 3.5 to 5.1 milliequivalent per liter. In hypokalemia, we can see ST depression, shallow, flat or inverted T wave, and prominent U wave. Prominent U wave is the characteristic features of hypokalemia. And the next question, food contraindicated in CRF and spironolactone treatment is options, option A papaya, option B beans, option C banana, option D maize. And the correct answer is option C banana. Banana is rich in potassium. There is an increased risk of hyperkalemia in a patient with chronic renal failure. CRF means chronic renal failure. We should advise the patient to avoid potassium rich diet. Here banana is a potassium rich diet, so we should avoid eating banana. Food contraindicated means food should not take. Spironolactone is a potassium sparing diuretics. This will help to keep our potassium level getting too low. But in case of CRF, we should not give potassium rich diet. Here in spironolactone also, we should not give potassium rich diet because already body is getting potassium. So again extra we are giving means it will be more potassium in the body. So we should avoid. And the next question, umbilical cord is also known as option A placental cord, option B phoenix, option C eucord, option D all of this. Umbilical cord is also known as phoenix. Option B is the correct answer. Umbilical cord is also known as navel string or birth cord or phoenix. It is the connection between the fetus to the placenta.